Hello and welcome to the Quality Insights Renal Network 4 Patient Representative Program informational video. Everything discussed in this presentation has been developed by patients for patients. Our objectives for this video include defining and discussing patient engagement, how the Network 4 Patient Representative Program is designed to help improve patient engagement at Network 4 dialysis facilities, and what is the role of the Network 4 patient representative. Let's start with why patient and family engagement is important. Don Berwick, who's the former CMS administrator for Medicare, said that patient and family engagement is nothing about me without me, which means to him that those who offer health care need to stop acting like hosts to patients and families and start acting like guests in their lives. Engagement, broadly defined, is an active partnership among individuals, families, healthcare clinicians, staff, and leaders to improve the health of individuals and communities and to improve the delivery of health care. Network 4 believes that patient engagement is involving patients and families in decisions regarding health and health care, and most importantly, should be tailored to fit their preferences. We also think that patients and families should be given the opportunity to be fully engaged participants at all levels, including individual care decisions, health system learning, and improvement activities, and community-based interventions that all work to promote health. Furthermore, Network 4 believes that patient engagement represents actions individuals take to obtain the greatest benefit from their healthcare services that is available to them. An engaged patient is one who is fully involved in and enthusiastic about their health, and thus will act in a way that promotes optimal health in the chronic treatment setting. Now, these are just some ideas that have come from the Network 4 staff and from the community of healthcare workers. Network 4 reached out in 2013 to their patient subject matter experts, and we asked them as patients, what does patient and family engagement mean to you? One patient responded that patient engagement is a patient being completely involved with their team, with the physicians, the dietitians, the social worker, and the tech when they're in the in-center setting, and to be completely involved with everything that goes on as far as their dialysis treatment is concerned. Another patient said that patient engagement is being able to ask questions about things you're not familiar with, like the term calcification. A third patient said that if you're engaged, you should not be afraid to ask questions. He said he's learning that the only dumb question is a question you haven't asked, and that you should not be afraid to ask, and ask again until you understand. That's what patient engagement is from these three patient subject matter experts from Network 4. But why is patient engagement important? There has to be more to it than that. And indeed there is. Patient engagement is important because it allows patients to be part of the process and part of the solutions to their own healthcare needs. It allows patients to own their healthcare and their healthcare plan. It provides patients control of their health, and it puts patients and families at the center of the care, resulting in working with patients rather than just doing to or for them. Most importantly, patients and family can play a critical role in preventing medical errors and reducing harm. To achieve patient and family engagement, it results in a partnership between the patients and the healthcare providers. So thus, healthcare providers must assume that patients are experts in their own experience of care, and they have information that the providers need to hear so they can act upon it. Healthcare providers also must know that families are the primary partners in a patient's experience of care, so the patient engagement must include their family. But how is this patient and family engagement really going to improve healthcare and outcomes for dialysis patients? Well, we went to the research and to the literature, and we found compelling evidence that states that patient and family engagement results in improved quality, safety, and outcomes of care. And it ensures that patients receive care that fits their preferences. The literature goes on to state that patient and family engagement reduces the use of diagnostics and healthcare services, as well as reducing healthcare costs. And the end result is that patients are more apt to follow their prescribed treatment. It increases their experience of care, and it increases their satisfaction. And it also increases the satisfaction and retention of staff and clinicians. So what do patients really think the impact of patient engagement has been on them? Again, we go back to our patients here at Network 4 and we ask them, what's the end result of patient engagement for you? And they explain to us that being engaged really gives them a reason to get up each morning. They feel it improves their feeling of worth, provides them hope, improves feelings of depression, and helps them adhere to their healthcare plan. And they really believe that being engaged helps them attain the highest level of health possible. They described it that it allows them to not just survive, but to thrive, and helps them embody the notion that dialysis means life. The Network 4 Patient Representative Program was designed to really help patient representatives bring forth this thought and to help encourage patient and family engagement at the dialysis facilities, to help spread Network's 4 motto that dialysis means life, or DML, and help to improve the communication between patients and caregivers, and most importantly, to make sure that the patient's voice and their experience of care is shared with fellow patients, dialysis staff, shared with us here at the network, and shared with CMS. So you're listening to this video today because maybe you've been asked to consider being a patient representative, or maybe you've heard about our program and you just want to learn more. So let's talk a little bit more about patient representatives and what the patient representative program actually is. First, at a kind of a high level, who can be a patient representative? Well, someone who demonstrates being a positive role model and who is engaged in their own or their loved one's care is a perfect candidate. This could be a dialysis patient, a kidney transplant patient, a family member, or even a caregiver. The 3 aims, or the triple aim for this role as patient representative, would be to provide support and mentoring for fellow patients. At times, serve as a liaison between the dialysis patients and the dialysis staff, or the dialysis facility and the network staff, or the dialysis patients and CMS. And lastly, provide a patient's voice in the day-to-day activities of the dialysis unit. Now, in looking at what can be achieved at the dialysis facility level, conceptually, this program seeks to engage and integrate the patient representative into key committees at the dialysis facility, and in doing so, to ensure a patient voice is represented. The committees that could be attended by a patient representative could be your quality committees, maybe your safety and fall committees. If you have a readmission committee, that would be a great place for a patient representative to attend and bring the patient's voice, as well as strategic planning committees. Again, being involved in committees helps bring the patient's voice to the group and to use that voice to consider improvement activities and special project outcomes. Some specific roles that a patient representative can take at the dialysis facility is really dependent on a mutually agreed upon activity between the patient and the social worker or the facility administrator. There is a plethora of things that a patient representative can do, but what really works best is if the patient representative and the facility kind of negotiate what that role is going to be. And you can start very slow and expand your role. Some of the things you can do as a patient representative is to share information from the Network 4, such as when you meet new patients, you should introduce yourself as a Network 4 patient representative, because you are also serving as a liaison between Network 4 and your dialysis facility patients. You may be asked or may consider to pass out the Network 4 patient newsletter. At times, you may need to inform patients about various things that the network is doing, such as our quality improvement activities, our publications, the patient's rights and responsibilities, as well as the Network 4 grievance procedure. And even in some cases, you may need to or feel the need to share the toll-free Network 4 patient phone line, which is developed for patients to have a place to call if they really want to have a discussion with someone else about their concerns besides their dialysis facility. As far as other activities a patient representative may consider doing, again, depends on what is going on at your facility, but some suggestions would be to welcome and mentor new patients. New patients are, as you know, sometimes a little bit lost when they first come to the dialysis facility, so having a patient representative is really helpful for these new patients. A patient representative can provide support and listening, hand out facility newsletters and announcements. They can participate in the aforementioned committee meetings that we discussed earlier. A patient representative can get involved in special projects, consult on facility enhancements, and be involved in updating and creating facility policies. And also, most importantly, assist with the development of educational tools for patients and families so that the tools actually meet the needs of the patient. Now, you might be saying, wow, how am I going to go about this? Who's going to support me? How am I going to get through this? Well, Network 4 has developed a patient representative program that supports the patient representative based on what level of engagement they would like to participate in. We've got 3 levels of participation as Network 4 patient representatives. The first level in green is being a patient representative just at the dialysis facility. And when I say just, that means your level of activities really is at the dialysis facility. Just doesn't mean a small amount of activities. Again, the amount of activities that you participate in will be dependent upon what you and your social worker and facility administrator have negotiated. But some patients want to go on and do more. So we have about 30 patients who are now active with the Network 4 in various committees and activities that we do at the network. And about 7 of those patients want to do even more, so they have become active with CMS at a national level. Now, how do we support patients throughout this process, throughout these levels of engagement? We call it our path to engagement. Patient representatives who choose the path of just participating in dialysis facility activities, we supply those patients with a patient representative handbook and a job description. This binder is sort of like your playbook for how you can really deal with situations that come up at your facility. We also have a monthly patient representative meeting, which is not required, but we put it out there 2 days every month so that patient representatives can come together for a short educational presentation and then spend time with networking, sharing, and supporting each other. We also have a patient representative only Facebook page, again for support and sharing of ideas. And we offer a variety of training for patient representatives. The first program we offer is a short program on quality improvement training. Once you've attended this meeting, then you can attend quality meetings at your facility. We also have the ability to provide you peer mentoring and support group training. Again, after you have participated in these trainings, you can either begin a peer mentoring group or a support group. And lastly, we will give you added education if you wish to participate in executive leadership meetings. We at Network 4 want to make you successful at your role, so we will provide whatever support and training you need to ensure your success. For those patients who wish to do more and come to the Network 4 office and participate in our activities, we recognize these patients as the Network 4 patient subject matter experts. They are all members of a patient advisory committee called the PAC. They meet once a month and guide the network in our activities. Each of these members have participated in a quality improvement training, and they participate in quality improvement activity advisors. Several of these patients join CMS on national calls with CMS with our contracting officer representative. And again, several other members are active in our boards. We have a board of directors, a medical review board, and the network council. So as you can see, there is a lot of activities that a patient representative can get involved in. And even with all of this activity, some of these patients who are active at the network level want more. So they are invited to meet up with other patient representatives from across the country and participate in national patient and family engagement learning and action activities. We call those patient lands, and they participate in national work groups solving problems with patients and developing tools. These patients also participate in national CMS meetings, both on the phone and annually in person in Baltimore, Maryland. So as you can see from this presentation, there's a lot of activity for a patient representative. How much or how little you do is dependent upon what you are comfortable with and what you and your dialysis facility have negotiated. We sincerely hope that after hearing this information, you'll be interested in learning more about being a patient representative. You can get more information at our website at www.qirn4.org. And when you land on the landing page, you can go to the Patient and Family tab and then scroll down to the Patient Representative tab. On that page, you'll find a variety of information that will help you learn more about our program. Or you can contact the network on our patient toll-free line at 1-800-548-9205. Well, that concludes our presentation today. We hope it has been informative, and if you have any feedback or any additional questions, please do not hesitate to contact us at the network. Goodbye and have a great day.